Today, the 20th of April 2024, I was given permission to meet Mr. Imran Khan in the Adiala jail in Rawalpindi. It has been some 4 months since I last saw him there. I was pleased to see that he looked very well physically and appeared to be in good spirits. Apart from occasional mild indigestion, he appears to be doing well under the circumstances. He is sleeping well, he's exercising regularly, and I was pleased to see that apart from his exercise bike, he's also started jogging within a small area that has been made available for him to carry out his exercise. He's eating 1 meal per day, as is his norm, and on examination his weight was 86 kilograms today, which is actually ideal for his height and his frame. His pulse was 48, which I've alluded to before is because of his very good physical condition. That's why it's lower than one would normally expect. His blood pressure was 105/70, and his oxygen saturation on room air was 99%. On further examination of the chest and of the heart sounds, there were no abnormalities on physical examination. So overall, Imran appeared to be in excellent physical and mental health today. A slight concern is that he has now been in prison for over 9 months and has had no blood tests during this time. Out of an abundance of caution, I feel it would be reasonable for us to check some baseline blood tests, including a full blood count, to check his hemoglobin, his kidney functions, liver functions ought to be tested. We ought to have a fasting lipid profile and a fasting glucose, and the hemoglobin A1C, which is a test to check your blood sugar level over the past 3 months. We would like that all of these be done through the Shaukat Khan Memorial Cancer Hospital laboratory system, and I believe that his lawyers will be courts for permission to allow us to do this.